Next on the Paw Report, Dr. Gregory Mauck is back from the Kaskaskia Valley Animal Hospital in Sullivan to talk all about heartworm and what you need to know to keep your pet safe. Teddy, Toby, and I will be tuning in. Will you? It's all next on the Paw Report. Welcome to the Paw Report. I'm your host, Kate Pleasant, and I'm joined today by Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital in Sullivan. We appreciate you coming on today.
Right. Well, great to be here.
And you're back, actually, because you talked about parvo last time you were here.
Right.
So this time we're going to talk about heartworm. And I think, first of all, why don't you tell us what heartworm is and what kinds of animals it affects?
Okay. One reason I want to talk about heartworm, because kind of like parvo we discussed last time, it's a disease we see a lot of, but it's a disease that's very preventable. So heartworm is a parasite, obviously, heartworm. Lives in the heart, but it also lives in the lungs. It'll get into the large vessels of the lung, and it actually lives inside the bloodstream, which is kind of strange. And so you think, well, how the heck did that get there?
Yeah, that was kind of my question on my mind when you said that.
So heartworm and a lot of parasites have very complicated life cycles, and you kind of think, well, you know, what's the chance of them actually completing that seems low, but it's very efficient. So heartworm is carried from dog to dog by mosquitoes. And a dog that has heartworms, the worms in the heart are anywhere from 4 or 5 up to 12 inches long. And they look kind of like a piece of spaghetti. They're kind of like a skinny piece of spaghetti. So that dog that has those adults in the heart, and heartworms are animals. You know, they're little animals, so there's males and females. And so they're mating in the heart and in the pulmonary arteries and producing millions of little tiny baby heartworms.
Oh my.
So the little baby heartworms, they're so tiny that you can line up 10 of them and they would only be across the period of a typewriter.
Really?
So that's how teeny tiny the little babies are. But a typical dog who has a typical infection of heartworms has enough of those babies that if you took just 1 cc of blood, there'd be about 1,000 baby heartworms in there. So they have millions and millions of little babies in their blood. So a mosquito comes along and bites that dog and sucks up a little bit of blood, feeding off of him. And so then those worms, little tiny baby worms, are now in the mosquito's mouth parts. Well, they migrate into his salivary glands, and they hang out for a few days, and they're changed in there. They go through a molt, and then they become infective larvae. So then a little bit down the road, a week or 2 down the road, that mosquito then can transmit those baby heartworms, now an infective version, to another animal. And so they bite the next dog and inject them into that dog. So when they inject them, they don't inject them into the bloodstream. They actually just bite and they just go under the skin, and they're crawling around under there. And so we don't really know why, but and with a lot of parasites, but they know. Now they don't know, they're not intelligent.
They're thinking, right?
They figure out in some way how to get to the heart. So what they do, they migrate for about 3 months under the skin.
That long, huh?
Yes.
Wow.
Then they get into a vein, a blood vessel, and travel back to the heart. And when they get back to the heart, there's little cords around the valves and things, and they kind of wrap themselves around those as they get into the heart, and then they grow into this adult worm. And so it takes about 5 months after the dog's bit till those worms are adults in the heart and then producing babies of their own. So that's called the patent period. And so during that 5 months, if you tested that dog, they wouldn't come up positive. So we'll talk about testing in a minute. So there's a little window there that we can test dogs, and they're not going to show up positive even though they've got heartworms. So that's how they're transmitted, by those mosquitoes. Now, the other thing too, we think about that, and we get bit by mosquitoes too. So people get infected with heartworms. Dogs get bit and injected with heartworms. The mosquito, he couldn't care less. When he bites, He's just injecting stuff in there to keep the blood from clotting, and so the baby heartworms come out with that. So when another animal or person gets infected with heartworms, our immune systems immediately recognize them. So they're crawling around under our skin too after you get a mosquito bite.
Oh, that's just creepy.
Yeah, kind of creepy. But our immune systems pretty quickly recognize them as foreign protein and attack them and kill them. And that happens in most other animals too. If it's a cow or a cat or whatever, most of the time. Dogs, the heartworm's surface proteins mimic the dog's, so they can they fool the dog's immune system.
Okay.
So the dog's immune system sees the baby heartworm, and they think they're dog proteins and leave it alone.
Okay.
So that's why that happens, and that happens occasionally in other animals too, like cats and things. Okay.
And so you can't always tell they could be positive with this for 5 to 6 months before you can even tell?
Yeah, and that's the tough thing about testing for heartworms. And this is one thing that comes down to with preventing heartworms in dogs, is you can't just rely on testing, and you can't just rely on your preventative, which we'll talk about. So it's real important that all dogs are on preventative 12 months out of every year.
Okay, so not just, because I think I've heard a lot of people, and I've been guilty of thinking it myself, never done it, but oh, it's cold. There's probably nothing living out there right now, so I won't treat the dog during the winter.
Yeah, and it used to be that we did that. During January and February, we would go off the preventative.
Really? Okay.
But we don't do that anymore, and for multiple reasons. But that testing, there's 2 ways to test for heartworms, 2 basic ways. One is to look for the little babies in the blood, and that's what we used to do. When I went to veterinary school back in the dark ages, we didn't have the fancy tests we have now. So we had to take blood, and you would either spin it down and look at it directly, spin it in a centrifuge, or we would run it through a little filter, and then take the little filter off and stain it and look for the little babies under the microscope. And so we can still test, and we do that occasionally, for certain reasons, to look for heartworms. And it's also very quick. You can take a little bit of blood, run it through the filter, and be looking at it in a couple minutes. So I'll do that sometimes when I have a dog who comes in with possible symptoms, just to do a real quick check. It's not as sensitive as the other test. So if it's negative, it doesn't mean they don't have heartworms. But if it's positive, we see the babies, we know they got them, and it's quick. The other test, which is much more sensitive, is we're testing for a protein that's given off by the uterus of the female worm. So you've got this female worm in there, and like I said, it's a little animal. She has a uterus, and so she gives off a protein from that. And so that gets out in the bloodstream. So we get blood, and it's treated in a certain way, and there's lots of different versions of this test, but they all work basically the same way. It's an immune test. It's an ELISA test. And so, but it causes a color change, depending on which test you're using, in a little well or on a little membrane that's used, but it causes a color change. And then you can tell that they're positive if they have that. And so that test is very, very, very sensitive, and it's very specific. If it's positive, you can be 99% sure that the dog's positive. It's also somewhere in the upper 90% sensitive. In other words, if you have heartworms, you run the test, it's going to be, say a 98% chance you're going to pick it up. None of these tests are perfect. You can do a test and it says it's positive, and they're not really positive. So we take that into account. So if we get a positive, before we start treating, we test them again multiple times in different ways a lot of times to make absolutely sure they're positive before we start doing this expensive and possibly, somewhat dangerous treatment. If it's negative, we also take that into account, because there are dogs out there who have heartworms who come up negative on the tests. And they call those occult heartworms or hidden heartworms. And it can be what we were discussing a while ago. Maybe they don't have mature worms yet.
That latent period where they can't be detected.
because they have to have a mature female.
Right.
Maybe they've only got males.
Okay.
Maybe they've got 3 males and that's it. And so they're not going to come up positive on either of the tests. They're certainly not going to be producing any babies, and they don't have any uteruses or uteri there to produce those proteins. So if you've got males only, we're not going to find them.
Okay.
Now you can get ideas through radiographs or x-rays, things like that. But that can be a very frustrating situation. Now, most of the time, those things don't occur. And most of the time, we can pick them up on the testing and find that. But it can be confusing sometimes. So we do take positive tests into account. Is that really positive?
Right.
And we take negative tests into account. Is that really negative?
Okay. So if I was at home with my dog, how would I know, or what should I be looking for if I thought the dog had heartworm?
Yeah. Why would you suspect?
Yeah. Why would I think that the dog might have heartworm?
Now, one thing, the vast majority of dogs that we find positive have no symptoms whatsoever.
Okay.
And we find those dogs through routine testing, and that's why. And we follow the recommendations of the American Heartworm Society.
Okay.
And it's what the U of I does. It's what everybody does responsibly. And the American Heartworm Society extremely stresses yearly testing. Some people will say, well, I'll just get my dog tested every other year. Well, that's not adequate at all, because we can have those slips that come through. And heartworm gets really bad pretty darn quick, over a few months. So yearly testing is really vital. We get dogs every year that come in who have maybe not been tested for a year or two, or they have been, but the people may not have been real good giving their preventative, or in some cases they are really good. We've had 3 dogs this year come in positive who last year were tested. The people got 12 months worth of preventative. They came up positive this year. We're seeing more of that, which I'll discuss in a second. But anyway, so yearly testing is real important, and that's how we find the vast majority of them. But if you were sitting there thinking, hey, I wonder if my dog has heartworm, it would be, the symptoms are mainly, coughing is by far the #1 symptom. It's just this constant hack, cough type of thing. Or a dog that's lethargic. And it's just typical signs of heart failure, because that's what heartworm leads to, is heart failure. So that's the main things that if your dog was chronically coughing, that'd be the main thing. But most dogs that come in coughing don't have heartworms. They've got other stuff. So just because your dog's coughing, don't become paranoid and think, oh, he's got heartworms.
Well, of course, that's a good reminder, though. Anytime you have a question, call or take your dog to the veterinarian, of course. So, so do you want to talk about maybe some of the, the processes when they come into the office, the treatments? Because once you find it positive, I assume you have to get moving on a treatment.
The treatment's changed over the years. It used to be an IV drug, so we don't use that anymore. The actual drug that kills the adults in the heart is an arsenic-based compound. The old one was more dangerous, was nastier. The new one is less nasty, I'll put it that way. It's still a dangerous drug, still can have side effects, but we don't have to do it IV anymore. We actually give it in the muscle, but we inject it in the back muscle. Which sounds kind of crazy, but it does sound a little crazy. Yeah, so it's injected in the muscles along the back, and it's basically the same muscle that in a cow where you get the ribeye. So it's that thing. So anyway, that's just a 2-shot type thing. You say, well, that sounds easy. But we give the drug, then it's going to be active over the next 2 to 3 weeks. It doesn't just, bam, kill the heartworms and then problem solved. It kills the heartworm very slowly. There's plenty of other drugs out there that we could give that would kill the heartworms in the matter of an hour or 2. But if you have 40 worms in your heart that are 1 foot long, and you kill those all at once, they're going to flood into your lungs.
Yes, what I would think is you would have kind of a, like a trash problem, essentially,
So we want them to die very slowly over a 2-week period so your lungs can handle that. they can't handle having a huge clump of heartworms pouring in there at once and all of that decay, because you'll die of severe lung disease rapidly. So we have to kill them slowly. So that's the good thing about this arsenic drug, is it poisons them slowly, and they die slowly over a couple, 3 weeks.
Okay.
So that's kind of the first stage.
Okay.
Killing the adults, then killing the babies. One of the other new parts of the treatment, actually, we used to jump right in, bam, we want to kill these guys and get going on this. Now what we do, we actually soften things up first, then we kill them. And so how we soften things up, they found a few years ago there's a bacteria called Wolbachia. Okay. And Wolbachia lives in the heartworm, and it's actually an important part of the heartworm's life cycle. Okay. Wolbachia is the heartworm's buddy. So, first thing we want to do is kill the Wolbachia. Kill those guys, and that makes the heartworm sick. So they're easier to kill. So the first thing we do is give a month's worth of an antibiotic called doxycycline. Okay. And that's a common antibiotic for respiratory disease, tick-borne disease, things like that. So we give that for a month and kill these Wolbachia bacteria. Now the heartworm is sick, easier to kill. Then we do the 2 injections to kill the adult heartworms. Okay. Then we wait a few weeks and let the heartworm adults all die, hopefully. The vast majority of time we get them all the first time. Sometimes we don't. We have a better kill rate with killing the Wolbachia. Then we go back and treat the baby heartworms in the blood. Now the baby heartworms aren't too dangerous to the dog. They can cause some problems because they can get in to the kidneys and different things. There's antibody complexes that are formed because of that, and they can plug up the filtering units in the kidneys, different things like that. Plus, we want to get rid of them so that we know that the adults are dead. Because if we keep seeing baby heartworms, then we can say, well, we've probably still got some adults we have to go back after. And the other thing, too, that dog, even if we kill the adults and he's got all these babies, he's still infective. Mosquitoes can still bite him and infect other dogs. So we want to get rid of those guys so we can get rid of heartworms out there. That's where we've been having our problem with heartworm treatment the last couple years. Heartworms, like other things, mutate. And especially in the Mississippi River Valley, we're seeing mutation of heartworms. They're getting harder to kill. They're getting more difficult for the preventatives to prevent. And so our old monthly oral preventative, when I first started practicing, we didn't even have that. We had a daily preventative. So the first year I was practicing, they came up with this monthly oral. And so that was fantastic.
Oh, I'm sure everybody thought, oh, yeah, once a month, great.
Yeah. And that's worked great. Well, that's been 27 years ago. And so it's starting to lose its effectiveness. The heartworms, they're seeing mutation mainly in the Mississippi River Valley, where we happen to live. And so they're becoming less effective. And so we're trying to move people over more. There's an injectable 6-month heartworm preventative. And so we feel like we see less resistance to that. We've had those 3 dogs I told you about that last year were tested and put on preventative. They were all taking the oral monthly preventative. And those clients are clients who do not miss a tablet. I mean, they're #1 clients. Got all their medicine, gave all their pills. Their dog still came up positive with heartworms. So I've seen 3 cases that just in the last year. But getting rid of the babies, I've been having trouble for 2 to 3 years of clearing the babies out of the blood. Even though we got rid of the adults out of the heart, we're having a heck of a time clearing the babies out of the blood because of this mutation.
I was going to say, part of that mutation process that's going on.
And so that's a problem. It's a problem for us in not knowing, is this dog really cleared? But it's also a problem for dog public health because these dogs are still infective to other dogs through the mosquito. And it can also cause problems in the dog. But we don't know if we don't get rid of them. We have to wait a long time to retest the dog with the antigenic test. That uterine protein, even after we kill the adults, it's going to hang around for up to 4 to 6 months or more in the bloodstream before it's finally all filtered out and gotten rid of. So if we have all the adults are dead, and we test a month later, they're still going to be positive on that test. Okay. So we want to get rid of the babies so it helps us know that we don't need to go back and kill more adults.
Right.
And that's rare that that occurs. But over the years, I've probably treated 500 cases of heartworm, and I've probably seen 5-6 times where the adulticide, the first thing, doesn't kill all the adults, and we have to go back and redo that adulticide. So we want to avoid that because that's the most dangerous part of the treatment. And so getting rid of those babies helps us in knowing that we don't have to do that.
Okay. So is the treatment generally successful, though? I mean, overall, it's not necessarily a deadly thing once you discover a dog has heartworm.
And that's one of those things where if we catch them early and get started on them before they have symptoms, if a dog comes in with symptoms of heartworm, then the treatment effectiveness drops. Now, it actually works just as well in a dog with horrible symptoms as it does in a dog with no symptoms.
Okay.
The treatment works well. We can get rid of the heartworms. The thing is, we can't turn around heartworm disease necessarily. What heartworm disease is, the reason the heartworms cause all the problems they do, it's not just because they're sitting in the heart, they don't drill into the heart, they don't damage the heart directly. It's just the body has an immune response to them. This worm sitting in there is giving off all these proteins, that one of which we test for. Well, all these other proteins, you know, little skin flakes off of the heartworm, just all that stuff that's there. If you have an animal living inside of you, it's giving off stuff. Well, the body has a severe immune response to that. The lungs respond to that by developing hypertension, high blood pressure. So a normal lung, the blood pressure is quite low. So the heart's pumping blood through it to get oxygen, comes back to the left side of the heart. Well, as the heartworms are giving off all this junk, the lungs respond to that by developing hypertension, and the pressure develops higher, higher, and higher. And so the right side of the heart, which is the weak side of the heart to begin with, because it doesn't have to work very hard to pump blood through these lungs, normally, as the pressure raises, that right side of the heart begins to fail. So heartworm disease is a condition of initially of right-sided heart failure. Okay. So as things progress, then you develop heart failure all over. Well, the hypertension in the lungs also, the lung blood vessels are, the walls of them are kind of puny compared to the other part of the body. Right. And so, so as the pressure builds, they expand and balloon out real easily. Okay. Well, as they do that, they start leaking blood and things. So the dog then starts coughing up blood and all these other nasty things. Yeah. So the pulmonary hypertension is really what kills the dog. At a certain point, that pulmonary hypertension becomes irreversible. So if we have a dog comes in, he's got symptoms, we can always treat him and get rid of the heartworms. The question is, is the pulmonary hypertension reversible? Okay. And in the early stages, invariably it is. If we have a dog come in who's coughing up blood, it's probably not going to be reversible. And even though we get rid of the worms, that dog's probably going to continue on a downhill slide and die of the disease, even though we've gotten rid of the worms. And so there's, you know, again, ones in the middle who may have symptoms, coughing, things like that, that we don't know. We treat them and hope for the best. Okay. So.
Well, Dr. Gregory Mauck, we're about out of time today, but we appreciate you coming down from Sullivan and being on the show and enlightening us about heartworms. So thanks again for coming.
Okay. It's great to be here.
What?